Okay.
And had like a click here, and I haven't been able to remove it.
Okay,
And I
so
also
it's
have the
whole arm pain.
yes.
And pain starting here and going down all the way.
Yes.
Okay. Right now, where do you feel the pain?
Here.
Okay, sorry, can I just move your hair a
Yes.
little bit? Yes, thank you. Here?
Yes.
Okay. Or from the spine also? No, just from the lateral of the spine going to here.
Yes.
Okay. If some of you like to come to the front, please feel free to do so, but just sit down, please, so you won't block other people's view. And also, I'm going to treat these people, but I'm not going to explain what I'm doing. Later, I will teach you everything. But this is the time in the morning we do the Chinese way. Okay? So I would like you just observe and you try to learn as much as you can from your observation. And after this, I'll give you a quiz. Okay? Okay. So I would like, is it possible to remove this? No problem. Thank you. Oh, that's easy. Well, that's very sexy.
Yeah.
Okay. Okay. So,
Actually, the pain is here now.
in the arm
Yes,
also?
it is.
So it's also here and going to the arm.
Yes.
For
It's
how long
moving.
do you have this pain?
Actually, the arm has been for 2 years.
Whoa, that's a
Yes.
lot.
And
Okay.
then this one has been for 6 months.
Okay, 6 months here.
Yeah.
Oh, so it first started from the arm.
Yes.
Okay.
So, but after when this happened,
Yeah,
it kind of connected the whole
thing.
Yeah.
Okay. This is, can you put it up to here?
Yes.
Okay, otherwise I can go in the holes. It's fine. I don't want you to crack it. It's a very nice one, so. Okay. Now for the arm, I have a question. Can you be more precise? Is it A, B, or C? Or you cannot? I know sometimes it's hard.
It's here.
It's more A, yeah, more here. Going down here also, or
Yeah.
at the moment? Oh, the whole wrist.
Yes.
Okay.
But the pain is here most.
Mostly
now,
here.
But I can feel some here too.
Okay, let me first try with this. Okay. So I'm kneeling on the lung channel from lung 5 all the way to lung 9. Okay. Now I would like you please move the arm and you tell me where do you feel the pain? Yeah, I know. Here, right? That's how acupuncture works. No, just kidding. Okay, just move the arm and tell me where do you feel it?
It's more around lung, large intestine 10.
10. So now just right there.
Yes.
Okay, everything else is fine.
No, it's going on from there and up.
So from this all the way up? Okay, what about here?
Not so much.
So this is okay.
Yes.
This is okay now.
Yeah.
So now just from here all the way up. Okay, to here?
No, not all the way up.
Okay, so about here to here?
Yeah.
Something like that. Okay. So let me just. Okay. would like you gently, you try your arm again. And tell me where is the pain.
Maybe a bit here.
A little bit here?
Yeah, a
Okay.
bit downer, lower.
Lower here?
Yeah.
Okay, so all this is gone now. It's good. You don't
Yes.
have to, yeah, you don't have to look for it. If it's gone, it's gone. Okay, so very good. Now we just need to work, is it, am I correct here?
It's a bit more this way. Yeah.
No,
I think
like
it's around
here.
there.
Okay. What about the intensity?
It's really difficult to.
Okay.
Yeah. It's not so much.
So it's very low pain.
Yeah, I really have to look for it.
Okay.
Yeah.
So now let me just try to be a little bit more precise. Just add one needle here and another one here. Okay. Now I would like you to try again. You move your arm gentle.
I can't feel it right now.
Good. Give me 5. Thank you. Good job.